I really enjoy educating patients and answering each of their questions. Those questions leading into a functional rhinoplasty, or sometimes called a functional septorhinoplasty, those are patients looking to improve their breathing. And you can think of it in 3 different categories: improving the way the external nose works as it breathes, the internal nose, or the septum. If you hear somebody say a septoplasty, that's what that addresses. And then the third component that's commonly addressed are the inferior turbinates. Those grow out of the lateral side of the nose on the inside, but on the outside, or lateral, that wrap around like this. They can become swollen, particularly in Austin or other allergy-prone areas, where they become swollen and they block the airways. So commonly we're addressing all 3 for patients, but of course, if somebody has a nice straight septum, then they don't need a septoplasty and they wouldn't have that done. But one of the things that I really like to talk about on that topic is that that's the surgical component. But there are 2 other things that are really important to breathing. One of those is allergies. Sometimes patients come in and their main problem is in fact allergies. The lining of the nose is very susceptible to that. Most of us in Austin have allergies, and so you know what that feels like to be swollen and congested. So sometimes that needs to be addressed first. And in fact, those patients who have already had that addressed, but they're still having problems, those make for an even better patient because we've already tried plan A, so to speak. But I think it's important to know that surgery doesn't change the allergy picture. And so patients still may need to take their Zyrtec at times, or even a Flonase at times. Some of our patients will get into see an allergist for the sublingual drops, or even the injections for allergy management. So that's an important component. Surgery doesn't specifically address that, but it's still really important for how the nose breathes. And then that third category is a use it or lose it category. And that's just similar to any muscle in the body. If you use your bicep more, the bicep will get stronger. If you breathe more through your nose will get better at breathing through your nose. The trouble is, for a lot of our patients, they haven't been able to breathe because of that mechanical obstruction, either from the septum or the external nose or those turbinates. And so we can improve that scenario, but I really like to emphasize that patients after surgery are going to need to essentially do their own physical therapy. There's a lot of awareness about this, I think, in some social media contexts. There are a couple of great books on the impact of nasal breathing. Athletes are really emphasizing it. If you watch the Tour de France, a lot more cyclists were wearing Breathe Right nose strips, or the internal one that expands the nose out to improve nasal breathing. And so after surgery, things are straighter, the nasal passages are open, but allergies may still be a scenario that needs to be addressed more thoroughly. And then the third component is really emphasizing and restoring nasal airflow, because the more you breathe through your nose, now that you can breathe through your nose, the better you'll be at it. So then the question is, what does this mean for you? And that's what a consult is all about. That gives me the opportunity to hear about your experience, what's working well, what's not working well, but also gives me the chance to do a thorough nasal exam on the inside and on the outside. And then the third part of that is just really talking through, all right, based on your goals or problems and based on your exam, here's what we can do about it. So if that resonates with you, if that describes some of the challenges you're having breathing through your nose, then give us a call.